Hi, good morning, Chris. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 23rd of October 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Chris Hedge.
All right, Chris, could you please confirm your candidate number?
Yes. My candidate number is 423404234.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How would you handle a situation in which you couldn't read a prescriber's orders?
In cases where it's challenging to decipher a prescriber's orders, a systematic approach is essential. Firstly, I'd rely on experienced colleagues for guidance. Cross-referencing the patient's case notes and analyzing the context of the situation can often lead to a sound decision. When necessary, I wouldn't hesitate to seek assistance from fellow healthcare professionals. As a last resort, if clarity remains elusive, I would consult with the prescriber directly. It's imperative that I refrain from making assumptions, as patient safety is paramount, and guesswork is never a justifiable approach.
What was your favorite clinical experience? Why?
One of the most impactful clinical experiences I cherish is the case of an unconscious individual who attempted suicide by ingesting a toxic substance, resulting in severe brain damage. The patient's condition was critical, with recurrent respiratory distress. Over time, as the patient regained consciousness, they began responding positively to the care provided. This experience stands out as my favorite, because it highlighted the profound significance of compassion and nurturing in healthcare. It underscored the importance of offering genuine care, even in the most challenging situations.
Have you ever done any volunteer work? If so, what was it like?
Absolutely. I had the privilege of participating in volunteer work during my final year of college. As part of World Health Day initiatives, our college and hospital management organized a blood donation camp in collaboration with the community health center. I was selected along with a few of my peers to assist the hospital staff during the event. We were actively involved in various aspects of the donation process. This experience holds a special place in my heart, as it marked my introduction to volunteer work, and I thoroughly enjoyed the opportunity to contribute to a meaningful cause.
How do you motivate patients?
Motivating patients is a fundamental aspect of healthcare. Patients often experience stress and anxiety during their hospitalization, and it's crucial to foster a sense of trust and calm. I begin by greeting patients with a warm, welcoming smile, which can instill confidence. Effectively communicating their medical situation in a calm and understandable manner, using language they are comfortable with, helps alleviate anxiety and prevent overthinking. I always aim to inspire optimism by using words and actions that convey hope and reassurance.
How do you set priorities in your work?
In the medical field, every task carries its own level of significance, and each deserves due attention. Therefore, I approach my work with a commitment to complete every task in a timely and efficient manner. However, adhering to the triage system, I understand that emergency situations take precedence, as they require immediate attention and care. It's my responsibility to ensure that all tasks, regardless of their priority, are executed with diligence and professionalism.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good afternoon. My name is Chris Hedge, one of the nurses working in this clinic. How can I assist you today?
Hi Chris, I'm feeling a bit under the weather, and I have an overseas family trip coming up next month. I thought I should check if I need a flu vaccination before traveling.
I'm sorry to hear you're not feeling well. First, could you please tell me your name and age for the documentation?
My name is Mihiraa, and I am 40 years old.
Thank you, Mihiraa. Let's address your concerns. First of all, could you please tell me more about your upcoming trip?
We're going to Europe for 3 weeks, visiting both urban areas and some rural parts too.
That sounds like an exciting trip. Mihiraa, it's important to consider getting a flu vaccination, especially when traveling. Getting vaccinated against the flu is essential for several reasons. First, it helps prevent the spread of the flu to others, reducing the risk of you becoming a carrier of the virus. Second, it minimizes the risk of falling ill during your trip, potentially saving you from unexpected medical costs. Lastly, by avoiding the flu, your immune system remains strong, making it better equipped to fend off other infections you might encounter. In short, vaccination serves as a protective shield, not only for your own health, but also for the well-being of those you come into contact with, and it can keep your finances secure by reducing the likelihood of costly medical expenses. By the way, Mihiraa, could you tell me about your vaccination history, please?
Yes. Actually, I had one this year, and I didn't have any side effects that I can recall.
Thank you for providing that information. It's typically advised to receive a flu shot annually, because the flu virus can evolve. It's great to hear that you're keeping your vaccinations current. Furthermore, I'd like to emphasize the potential benefits of a booster dose. Boosters can significantly increase your antibody levels, which are crucial for your immune system's defense. They also offer enhanced protection against emerging flu variants, as the strains rapidly change, further reducing the risk of severe illness. Would you be willing to consider a booster shot?
Yes, if it's necessary, I'm willing to get a booster. But, when should I take the booster dose? Is it still effective if I get vaccinated now?
I understand your concern, and you're absolutely right to be conscious of the timing. Ideally, it's best to receive your vaccination at least 2 weeks before your international journey. This gives your immune system the optimal time it needs to build up strong protection. Additionally, by getting the vaccine in advance, you'll be better prepared to manage any potential side effects, ensuring a smoother and more comfortable travel experience.
Thank you for explaining all of this to me. I want to protect my family and enjoy our trip without worrying about getting sick.
That's a wise choice. Well, Mihiraa, before concluding, let me summarize our discussion. It's clear you're getting ready for an exciting overseas family trip. The flu vaccination is essential because it will protect you from spreading the flu, reduce the risk of getting sick during your trip, and make your immune system stronger to fight off other infections. I see that you had a flu shot earlier this year with no side effects, which is great. To ensure you're well protected, I recommend a booster shot to increase your antibody levels and guard against new flu variants. Ideally, it's best to get the booster at least 2 weeks before your trip, which will allow your immune system to build strong protection and also help you manage any potential side effects effectively. Does this all sound good to you?
Yes, that sounds good. Let's go ahead with the booster.
Perfect, Mihiraa. I'll get the vaccine ready for you. If you have any more questions or concerns before your trip, please don't hesitate to reach out. We want to ensure you have a safe and enjoyable journey. Safe travels.
Sure, I will. That is the end of your OET-speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.